In the last videos we described Hashimoto thyroiditis and talked about the role of selenium and vitamin D in the disease, according to a review study published in 2017. So, if you haven't watched it yet, we encourage you to take a look at those videos and then come back to this one. The main idea of this study is to draw attention to the role of diet for the management of this disease, by compiling the literature research regarding the importance of iodine, selenium, vitamin D, and gluten. For simplicity purposes, in this video we'll focus on the role of gluten, but again, we encourage you to watch the other videos as well. Celiac disease is an immune-mediated disease characterized by chronic inflammation and destruction of the villus structure of the small intestine. It is triggered by the ingestion of gluten, a protein complex found in wheat and related grains, such as barley and rye. Celiac disease has increasingly become considered as a multi-organ disorder, often presenting with diarrhea, malabsorption syndrome, and weight loss, and has been linked to a number of diseases including autoimmune disorders. That's why gluten sensitivity is now linked to Hashimoto's disease. According to this review, a meta-analysis in 2016 concluded the prevalence of celiac disease in patients with autoimmune thyroid disease was about 1.6%. Even though that doesn't seem like a very high percentage of people with both diseases, according to the International Medical Bibliography, autoimmune thyroiditis and celiac disease are clearly associated. This might be explained partly by the increased immunosensitivity of celiac patients or by the deficiency of key elements such as selenium and iodine due to malabsorption, or due to antibodies that affect both types of tissues. So far, science has been unable to establish a causal relationship between these two conditions, which means it's not clear that a gluten-free diet can prevent autoimmune diseases. However, the study concludes that Hashimoto's patients with or without celiac disease benefit from a diet low in gluten as far as the progression and the potential disease complications are concerned. In fact, a 2019 pilot study in Poland assessed the effect of gluten-free diet on women with Hashimoto's disease. In this study, two groups were formed and the group with a gluten-free diet experienced a significant reduction of antibodies in the thyroid and an improvement of thyroid function. This wasn't attributed to any coexisting disorders nor to the action of any drugs taken by patients, and not even a consequence of the improvement in the diet composition. Before we conclude, please don't forget to subscribe to our channel if you're curious about science applied to health issues, and hit that bell icon to receive the notifications every time we upload a new video. In summary, the presented data demonstrate a relationship between gluten and autoimmune thyroiditis, but the nature of this association isn't yet clear. However, it seems a gluten-free diet is a promising approach to improve the clinical markers of the disease and possibly delay its effects.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.